Doctors have expressed concern on the probability of the fulfillment of the promises made by the Jubilee government, more specifically those regarding maternal health care. The subject is mired in confusion and they now demand clarity on the issue.
Our understanding as doctors is that the whole process from antenatal care to delivery will be catered for. That's an excellent thing, and in fact that's what we are praising. However, if it turns out that that's not actually the case, then again it highlights the need to have health professionals advising the presidential team on issues of healthcare and in terms of pledges.
It turns out that currently doctors struggle to cater for paying clients, and with an increase of mothers seeking maternal health care expected as a result of the waiver, then a lot needs to be done.
In order for this to work, we need to ensure that we first retain our personnel so that they stop leaving, and then we employ more of them so that we're able to meet the demand. Additionally, facilities need to be adequate.
Well, and the cost factor is not the main issue of concern, as 40% of mothers deliver their babies in the absence of healthcare practitioners, and money is not the reason for this.
There are people who would want to deliver in a hospital. They have money to pay, but they just can't access it. They live 80 kilometers from a facility where they're doctors.
All the while, the brains behind the manifesto that presented an idealistic life for Kenyans remain optimistic that it can be done, and so in 100 days, Kenyans expect free maternal health care, among other promises.
We do not just say things for the sake of it. We do not promise Kenyans things we don't want to deliver. We are actually keen on ensuring that we deliver on the promises made to Kenyans.
But it is the cost of the promises that is casting a shadow of doubt, as the cost for normal delivery ranges from 4,600 shillings to 7,000 shillings, and that for C-section is between 7,000 shillings to 10,000 shillings in Pumwani and Kenyatta hospitals, which are the most sought-after health facilities.
If we go by the Pumwani rate and we want to cover all the 1.5 million births every year, then we are talking about 12.5 billion per year to cover 100% of all the mothers that are delivering. And at the KNH rate, this will be about 25.5 billion to cover all the 1.5 million mothers who are delivering.
Regardless of the cost, the rate of mother mortality is too high to ignore, and the waiver will go a long way towards reducing it. Charity Wawerumwangi for JSO at 7.